Mr. Mark Cook is a single 35-year-old accountant. Although Mr. Cook was a patient of record in Dr. Hastings' dental office, he had not been to the dental office for 3 years. Mr. Cook made an appointment with Dr. Hastings after injuring his maxillary right central incisor while playing basketball. During this appointment, Dr. Hastings found that the tooth was severely fractured and required endodontic therapy and a crown.
Hey Mark! I'm just looking at your chart here. How's it going? What brought you in today?
Dr. Hastings, you will not believe it. I was playing basketball yesterday.
Oh,
And
what happened?
It shoved.
Okay, let me just take a look at this. I do
Can
see
we
you
put
have
it
some
back?
notes on your chart here. I'm sorry to hear that. Okay, I'm just gonna have to check inside real
So
quick.
embarrassing.
Let me just check. Okay, let me just write some notes. It does look like we are gonna have to do a root canal on that tooth and then add the crown on after. Is that okay?
It hurts.
Yeah.
Yeah, that's fine.
It will cost $1,000 for everything.
Sounds good.
Yeah, you're okay with that?
Uh-huh.
Okay, I'm just gonna set up everything for the root canal and then start the procedure, all right?
Wonderful.
Okay,
Perfect.
let me just do this. Okay. Okay, let me just start everything. Oh, it does look like your gums are a little inflamed. It looks really red and bulbous. Oh, what's
They
going
bleed
on?
easily.
They
yes.
do? Okay, I'm gonna recommend that you see our hygienist.
Okay.
So after this, maybe you should go and schedule that appointment with her.
Okay.
All right?
Great.
Okay,
Yeah, I
perfect.
will.
So, Mr. Cook, I see that you checked in on your health history that you have a heart defect.
Yeah, but it's fine. Nobody ever wanted me to take a pre-med or anything like that. Yeah, it's fine. It's just very minor. It's fine.
You sure?
Yeah.
You know, Mr. Cook, I still have to call your doctor just to be on the safe side, okay? I'll be right back. Just give me 3 minutes, okay?
Yeah, we could make this speed up a little bit.
All right, Mr. Cook. Still doing okay in here? So I just called your
Wait.
doctor and unfortunately, you know, he told me that you have a heart defect that requires a pre-medication before before your appointment, I know. You know, we still have to do that.
Exaggerating.
pre-medication.
No, I do not want a pre-medication. I do not need any antibiotics. I am in a hurry. It's
no.
tax season. I cannot get another appointment. I cannot get time at work.
Yeah, we'll just probably do like one.
Can you already put some in there? Some
We'll
instruments?
probably just do one more appointment, just you know, we'll reschedule, and so you can
I'm
get the
scheduling. I cannot come back here and I'm gonna be dirty.
Oh,
Can we just,
okay.
I'll sign anything you want. Let's just,
So, Mr. Cook, I think we just need to sign, you know, a paper that will state that you refuse
Wonderful.
the pre-medication.
just hit it. Perfect.
Okay, thank you. I'll be right back with you.
Miss Gale performed a gross debridement with the ultrasonic scaler. Because of the profuse bleeding of Mr. Cook's gingival tissues, Miss Gale requested that he make an appointment for a follow-up prophylaxis in 3 weeks. Mr. Cook did not keep his appointment. In fact, he did not return to Dr. Hastings' office for 9 months. After 9 months, Mr. Cook calls in and schedules an emergency appointment at Dr. Hastings' office because he was in pain. Receptionist, Miss Sarah Charles, schedules him for an emergency appointment. Hello, Mr. Cook. How are you doing today?
In a terrible pain.
Oh, I'm sorry to hear that. I see that the fees still need to be covered from your dental hygiene procedure. Would you like to do some of that right now?
Let's do the appointment first and then we will do that after.
Are you sure you can't give me, like, any?
I'm in so much pain.
Okay then.
Think.
I'll let our assistant know and she'll come get you and bring you back.
Okay, thank you.
Hi, Mr. Cook. How are you today? Oh, follow me back. Let's take an X-ray.
Not good. Hurts
see it
like
right
a
here.
devil.
Oh, I'm sorry. Let's take an X-ray, and then the doctor's gonna come in.
Oh yeah, it's on this side. I got confused.
Beep.
Hey Mark, good to see you again.
Dr. Hastings, horrible. So this look is fine, but so terrible pain right
Okay,
now.
so I do have some bad news for you. I did just take I just looked at the x-ray that Clara took for me. It does look like you have an abscess forming in your tooth. However, I'm not going to be able to treat you until you do pay me for the past treatments that you haven't
But
paid
this is
yet.
an emergency visit.
I know, but you have a really large bill, and I just can't treat you
But
until
I'm
you pay
in
me
pain.
that. I'm sorry, like I don't know what to do.
Well, this is outrageous. I am done here.
Okay.
Mr. Cook schedules an appointment with another office where the treating dentist is Dr. Warner. Mr. Cook fills out the health history form, hands it to the receptionist, but does not mark that he has any health history heart concerns.
Hi, Mr. Cook. Welcome to our office. I'm Dr. Warner. I heard you're here for a consult today.
Yep, pleased to meet you. And terrible pain right here. Oh, horrible.
Okay, so tell me what's going on.
I went to Dr. Hastings' office just yesterday, and he said I have an abscess
Okay.
and I have an infection,
Wow.
and I'm in terrible, excruciating pain. And he said he will not treat me.
You said he won't treat you?
He said he won't treat me,
Wow.
and I find that extremely unethical.
Yeah, definitely.
Super rude.
Me too. I think you should probably report him to the dental board.
Oh, good idea. So, can we fix?
Yeah, I'll see what I can do for you.
The following day, Miss Sarah Charles, the receptionist for Dr. Hastings' office, had lunch with Miss Elaine Lane, who is employed in Dr. Warner's office as a dental assistant.
Hi, how's it going?
Hey, how are you?
Good, how are you?
Good. Want to hear a story?
Yeah, while we sit here and eat our lunch.
So you know that patient, Mr. Cook, that just transferred from your office to ours?
Oh, yes. Tell me everything.
He just came in with an emergency for a root canal, and he's really mad at Dr. Hastings.
Oh, Ellen, don't even get me started. This guy's such a deadbeat.
Yeah.
Let me tell you the whole story. So, he comes in, he needs a root canal because his tooth is like so awful. And Dr. Hastings sees that he needs a deep cleaning because his mouth is like so nasty, so dirty.
Mm-hmm.
So he goes to see her hygienist. It doesn't pay for either service, neither one of them. And then our hygienist sees that he marked something on his health history, really serious. I don't know 100% what it is, but I think it's AIDS. And I just told Dr. Hastings, like, you shouldn't see this guy because he just has such a temper and he's
Yeah.
awful. And
Yeah.
he probably is going to give you AIDS.
Yeah, probably.
Miss Lane and Miss Charles were so busy with their conversation that they were not aware that several people in the restaurant could hear every word spoken. One of these people was Mr. Cook's sister, who called him immediately after lunch and reported every word that she heard. Miss Clara Jenrette is also a dental assistant for Dr. Hastings. She has been with him for 18 years and just celebrated her 61st birthday. Although Dr. Hastings appreciated her years of service, he lets her know that she is no longer employed.
So, Clara, I do have something to tell you. Lately, just with everything going on in this office, I just really need some new, fresh ideas in this office. And I don't think I can keep 2 assistants anymore. I don't know really how to say this. I'm sorry.
Are you breaking up with me?
It's not you.
Oh,
It's me.
you are
but-
breaking up with me?
I'm so sorry, but you're being fired.
Oh, what? This is so unexpected.
I'm sorry. I just can't keep you in this position, and in normal conditions I would naturally provide you with just 2 weeks severance pay, but you are being fired.
Oh wow, that's unexpected.
I'm sorry.
1 month later, Dr. Hastings places an ad in the local newspaper requesting applications for a dental assistant's position in his office. He receives 4 applications. One applicant was a 23-year-old man with 5 years of dental assisting experience in the U.S. military. Another applicant was a 32-year-old black woman with 7 years of dental assisting experience. Another applicant was a 52-year-old white woman with 20 years of dental assisting experience. The last applicant was a 25-year-old white woman who had 1 year of experience in a hospital setting processing forms for the admissions department and 2 years of experience in a local modeling school. Dr. Hastings hired the last applicant because of her diverse experience.